A second case of measles has been confirmed and health experts warn it has the potential to spread rapidly.
The cases are linked, which Te Whatu Ora says is reassuring, but it could still be several days before we know if there are any further infections. Lauren Hendrickson has more.
If there's one thing that sets measles apart from other illnesses,
it can spread like wildfire through a community.
And that's why Albany Senior High School started online learning today as investigations into the infection here continue. The second confirmed case is a household contact of the student we already know about. They recently travelled overseas, which provides a link back to the border, and it was to a country known to have measles.
We are confident that this person is the source of this infection.
Early investigations have revealed that almost 80% of students have either had 1 or 2 doses of the MMR vaccine. Staff immunity is still being worked through, and that will be the key decider of whether the school reopens on Monday.
If a person has not had 2 doses of MMR, then we are asking that they will remain in quarantine.
Chemist Warehouse in Albany is a location of interest, but from way back on the 20th of April. The problem here is it can take up to 10 days for the virus to develop and then potentially a further 4 for symptoms to show.
So we can't let our guard down at this stage.
On top of that, measles symptoms can be easily mistaken for something else.
At the start, it looks a bit like a cold with a cough, a runny nose. It's a really chesty cough, you get red eyes, and then over 2 to 4 days you get the rash.
Dr Mataroria Linden says tamariki are some of the most vulnerable.
Especially the under 5-year-olds, and they're at risk of complications from measles in terms of hospitalisation.
And you don't have to look far to understand how deadly the illness can be. In 2019, close to 6,000 people came down with measles in Samoa. 83 people died. The majority were young children.
This is not a disease I would wish on anyone.
But it could all be avoided with one crucial tool.
It is vaccine preventable.
In other words, measles preventable. Lauren Hendrickson, Newshub.